morning, Hoffield Health Centre. How can I help?
If I go like that,
Yeah.
can't hear anything.
OK, well, don't go like that.
You still working?
Oh, yes.
Are you?
But since I lost my husband, I'm so glad to have the extra company and people to talk to.
Yeah.
Some poor soul's waiting for an operation, needs that table, and I'm taking up the space.
You're as entitled to anyone else, though.
You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy.
The church is absolutely fine. There's nothing wrong there. It's just me. Some days I'm absolutely fine, and another day I am absolutely wretched.
Many of our patients have been coming here for longer than I have been a GP. In fact, some of them have been coming to the surgery since just after the formation of the NHS itself.
We're all living longer. At 65, a man can expect to live for another 19 years and a woman another 21 years.
There we go, sir.
Right.
Yeah.
This is all modern technology for you.
They'll replace us soon, don't worry. You'll have a little robot before long.
Yeah. Well, yeah, you won't be there at all. You
We'll be redundant, yeah.
How are things?
Carpal tunnel, sweetheart.
Right.
I can't sleep at nights.
OK.
I'm getting all through the day as well.
Right.
I saw Dr. Roberts a long time ago. He gave me an injection, a cortisone injection.
Yep.
It's all come back now.
OK. So how is it affecting you?
I'm dropping things,
Right.
can't pick things up.
Ooh, right.
I go with my daughters one day a week for a meal,
Yeah.
and they got a knife and fork for me, big like, you know. Can't cut things up like,
Right,
you know.
OK.
I lose all sort of feeling in the
And is
thing.
it both hands?
Both hands.
Yeah. And is it pain?
It's a constant pins and needles all the time.
Right.
All down here. At times I get such a pain in here, and it goes up my arm as well. I don't want to chop it off. If I chop him off, I can't chop him off.
And does it go into all the fingers and the thumb, or just...
No, just this lot here.
Yeah. Let's have a little look. OK. So any tenderness in the wrist at all?
No.
No. OK. And if I bend this back...
No problem. It's probably the ageing process, is it?
God, are you really 92?
I am, sweetheart.
You
yeah.
look fantastic.
Oh, thank you.
I thought, how old are you? In your 70s? Whoa, that's fantastic.
Cherry Arnold, please. I'm usually impressed if people cycle here.
Oh, are you?
But to cycle here through the rain...
Oh, well, it stopped raining. Well, nearly stopped raining.
I was about to be terribly impressed. You should have told me it hadn't stopped raining.
No, nearly stopped raining.
What can I do for you?
I've got a sore mark here, and I had treatment for a basal cell carcinoma on my back before, and I want you to have a look at it and see what you think about it.
What's the easiest way?
Yeah.
This here?
Yeah.
Well, I don't think that's a... I don't think there's anything sinister at all. What it looks like is a fungal infection. How long have you had it? Do you know?
When did the last one? I'm going to say a year or so. But sometimes it's very itchy, which is what happened to the one on my back.
Basal cell carcinomas aren't usually as big as this. They're usually raised, and they're also usually 1.5 centimetres. It just doesn't look right for that.
It doesn't look right. That's OK.
The reason I think it's fungal is it's flat.
Yeah.
But it's a bit pink at the outside and paler in the middle.
Yeah.
And that's how they behave.
Right.
I think the only sensible thing is to give you some cream to put on that.
Yeah.
Which is the right thing, if I'm right. And I think it would probably be sensible for you to come back and be seen by somebody.
Right, OK.
I'd be very surprised if it turned out to be another basal cell. It just doesn't look like it.
No, that's fine. It's just that it's worth checking up on these things.
Oh, yes, sure. You look from this terribly fit and healthy.
Yeah, I am terribly fit and healthy. Yeah, no, that's fine.
All right.
OK, fine, thank you.
And here's this is something to. Come here. For some reason, they calculate a frailty score.
Oh, right, OK.
I think it's because of your age, but for no other reason. I have to answer this question about you.
Right, OK.
This patient is mildly frail. Much worse than that, the patient is severely frail. We'll say you're not particularly frail at all. I'm not allowed to put in.
This is a joke.
Yes. If I'm as healthy as this when I get to this patient's age, I shall be doing terribly well. Go away.
Yeah, no, I'm doing really well. That's fine. Thank you. Bye.
Right, so it sounds like carpal tunnel. When you had those injections before, did it help?
It did help, yeah.
I don't personally inject carpal tunnel, but some of the other doctors do here, so we could ask one of them to do it. Alternatively, we could refer you to the musculoskeletal clinic to consider surgery.
Yeah, but at my age, is it worth the surgery?
It depends how much is bothering you. I mean, you seem like a fit 92-year-old, and the fact it's affecting you eating, that's quite significant, isn't it?
Yeah, but if I have that injection,
yeah,
it might last for a few months, like, you know.
It might.
And in a few months, I could keel over, couldn't I? Like, but if I could have got there, and some poor soul's waiting for an operation, needs that table, and I'm taking up the space.
You're as entitled to anyone else, though.
Well, yeah, but...
But you want to try the injections?
I feel guilty taking the time.
Oh, you shouldn't do that. Why don't we then ask one of the other doctors to give it a try? But there is the option, OK? And we're not ageist. The other thing we could do in the meantime is add a tablet called amitriptyline, OK? Because this is a nerve problem. It's compressing one of the nerves going through the sheath in the wrist, OK? It would be one at night. They do make you a bit sleepy, but then because the pain is at night, it might help. Yeah, I think it's worth a try.
Please.
OK?
Thank
there
you.
we go. If you take that to the treatment room and they'll see if they can book that appointment for you.
Thank you, doctor.
But if it doesn't work, come back to me and we'll refer you to the surgeon.
Oh. Thank you, doctor.
I'm not doing that.
Thank you, doctor.
OK, bye-bye.
Can I help?
Problem with mine? Asthma, no, man. 1020.
10:20, OK. Ah, I know what it is.
You do?
It's next Monday.
Stupid fool. Old age coming. Thank you.
That's OK.
OK, come and sit down. Right, so how can I help?
Well, I've still got this awful pain and it's just about really getting me down. Okay. I've had it, this is going on the 3rd week now. And it's all round here and it keeps me awake at night.
OK.
And it's terrible, it makes me cry.
Oh dear. Right.
I'm in agony with it.
So tell me a bit more about the pain.
The burning pain.
Yeah.
And it's all round here and at the bottom of my back.
And does it feel like it's inside your tummy or is it more on the surface?
It's right there, and
OK.
on the side.
Oh, right, OK.
But that's the tablets I'm on. That helps a little bit.
I think I need to have a proper look at this again. Is that all right?
Yes, of course it is.
So if you lie down on there, I'm going to have a little feel and you tell me, is that making it worse or is
That's
it...
not too bad on my stomach. Round there, it hurts.
That hurts?
Yeah.
What about if I'm going to push your ribs a little? Is that a bit sore?
That's not too bad, but that is.
That is?
Yeah.
Thank you. And he takes... I'm talking like he's not here. Sorry.
She looks after me well, my wifey.
I've actually got an orchid which I've kept for our wedding anniversary, isn't it?
Absolutely amazed. You normally kill everything.
You come for the results, is that right?
And you said to come back.
With a witness.
Unless I wear flat shoes, I've got a job to walk.
Why do you wear heels a lot?
My wife won't let me.
In 3 weeks' time is my golden wedding anniversary, and my wife wants me dancing.
Oh, does she really? All right, we better get you sorted there.
Would you mind sitting up? I just want to have a good look at your back.
You're going giddy.
Oh. Yeah? Got up too quick, I think.
Yeah.
You OK?
It's my age, I'm getting old.
Right.
I can't wear a bra, see?
Yeah. I'm going to press on your back, and I want you to tell me if it hurts.
That hurts.
That was it, was it? That one?
Yeah.
Further down?
Yeah.
OK, fine, you come and sit down. Right, I think this is actually related to your back, having had a look at it. What it says on the X-ray is that one of your vertebrae, right in the bit where it really hurt when I pressed around there, there's a little, what they call a tiny wedge fracture. So it means that it's a little bit squashed. And this can happen if your bones are a bit thin, which, you know, unfortunately, as you get older, that often does happen. And then the pain I think you're experiencing is coming from that bone out along your lower ribs. The pain from this sort of thing often goes on for about a month to 2 months. And I know, and it just gradually settles down by itself as the bone gets used to the slightly new shape. It does just get better. Would you like something stronger to take at night time to get you a good night's sleep?
Well, those tablets, they make me sleep, don't they?
Yes, you sleep quite well.
They make me sleep, but I'm nearly out of them now, so...
So let me give you some more of these. All right, I'm sure you'll be feeling a lot better.
Well, I hope so,
soon.
anyway.
OK, thank you very much.
Bye-bye.
Thank you.
My husband would like to make an appointment.
Yeah, what's the problem?
Back.
Oh, back.
Your back, okay.
That Friday
It's
morning.
getting worse.
Friday morning, 10:40.
Yeah, that's good, isn't it? Yeah, Friday morning.
Hang on, no.
Why?
Bed's coming for you.
Coming in the afternoon, darling.
Oh,
and Philip's home all day, and I'm there. Right, that's super duper, lovely.
Right.
Come on, will you?
Lovely, bye-bye. See ya, bye-bye.
Come in, Mrs. Jones.
Thank you. Right, lovely. Where did I put my bits?
Put all your bits on this bit.
Certainly.
And then sit on this chair for me.
Take that.
And you're here for your lithium blood test.
Test, please. Lovely. Oh, this is over jolly nice.
Well, how are you today?
Pretty well. It's lovely.
Sharp scratch. Your vein's gone.
You won't believe it. When I had this done in Southmead, somebody spoke to her as she was doing it, and blood shot all up.
Oh, did you?
Yeah, so maybe she's taken it all.
Oh, they are.
Oh, super, right.
So have you got any plans for today?
Yes, I'm going to the hairdresser's this afternoon, thank goodness. I should be glad to get my hair washed. Back to work tomorrow, then.
What, are you still working?
Oh, yes.
Are you?
Lovely. I couldn't stay home. I couldn't.
Wow.
No, I enjoy it.
What do you do?
I work on a refund desk. When people bring everything back, I have to check the receipts and mark it in and give them the money back. They're very good, though. They give away quite a lot when sometimes you think, yeah, they've used this a lot.
So how long have you worked there for?
14 years. 7:30 in the morning. Never mind. Gets me out the house. I think that's the main thing, isn't it?
Is it part-time?
Oh, yes, yes. But since I lost my husband, I'm so glad to have the extra company of people to talk to.
Yeah, that's the thing, isn't it?
So there we are. Let's get my clothes on. Thank you.
They should be ready about after 11 on Friday.
Oh, right, lovely.
OK.
Thank you very much. Let's pop this away.
All right.
Thank you very much.
Take care.
Right.
Bye now.
Bye-bye.
Right, do you want a long story or a short story?
I want the story I need to be told. And, I want an interesting story.
Yeah, well, it is interesting because I got this condition called myasthenia gravis.
I saw that. Yeah.
Last year, I was at work and I'm speaking the way I'm speaking now. This is not my normal voice. And my eye was closing. And I just thought I had sinuses because of my speech. So I went to see my local pharmacy, and she said, I think we all call an ambulance. You don't look well. Got taken to the hospital. My heart was fine. They eventually got it down to that I had myasthenia gravis.
Myasthenia gravis is an autoimmune condition that affects the receptors and muscles so that the nerve signals that make the muscles contract don't work as well. And what the patients experience is fatigue. Everything's a huge effort. Their eyes don't work so well. They get double vision, and it often affects their speech as well. This is not a terribly common condition. I think this is only the second person I've ever seen with this, and I've been in practice a long time.
So what is happening today?
Basically, I want a ESA form. With my condition now, I can't stand for too long. My peripheral vision has been affected.
How much does it restrict you in terms of what you'd like to do?
Everything. Because I said I got no motivation. Then the only way I can describe it to normal people, right, is lazyitis. I don't want to do nothing. I said, because of my speech, people think I'm drunk. So that knocks my confidence, because I said, my job was a CCTV operator and security. And I did that for 14 years, loved every minute of it. And,
but you haven't been able to do it since?
No, but I said, I said, well, get me an alternative.
Okay.
But they give me like a desk job. I can't focus. I get bored.
Stop.
So, I'm sorry. I do waffle. I apologise for that.
Right. But you only want me to do a form for your work?
Yeah, because I said there's nothing else that you can do, Dr. Jewell. I get very isolated now because I said I don't go out.
But you could go out, couldn't you?
No, yeah, that's what I'm saying. But I love my football. I love to go and watch football. And I never missed a game at home. I only seen one game. That's just bring me down an awful lot.
I think you have to adjust to the state of mind and try and do your best. I mean, I would say, you know, if you want help to make sure you can go to football, go to the club, ask them what they need from us.
Yeah, but again, I do apologise for interrupting. Again, it may seem trivial to you, but I have to go to the club to explain.
Mr. Easter might live for another 20 years or more. And you need to work out what is going to make life worth living.
Exactly.
And do something about it. I agree it's difficult, but it just seems to me that it's important to do the things that will give you a sense of enjoyment. Off you go.
Dr. Jewell,
nice to meet you.
I appreciate it. Thank you very much indeed. You take care of yourself.
Bye-bye.
Bye-bye now.
Yeah, I'm not supposed to live up your eye lately. I don't know, Hazel. Since I hit 60, it's been downhill, I tell you. I feel like an old crock. Put it this way, the brain don't feel like an old crock, it's the body that is.
Have a seat. Right, what can I do for you?
This business on the eye.
The one right in there?
Yes.
Yep.
I've had one that I dealt with about 2 months ago. Well, I didn't deal with it, dealt with itself. It was right here behind the ear.
Right.
And that one morning, all the thing had burst and come out. So this has been growing at a stronger rate lately than before. It's been there for quite a while.
So would you say it's doubled over how many months, how quickly?
I should have thought doubled over about 6 weeks, something like that.
Right, so that's quite significant, isn't it?
Yeah, it's really.
Is it painful?
No, not at all, no.
And does it affect your vision at all?
Not at the moment.
OK, let me have a closer look. Right, OK. It's about 1 centimetre by 0.6. The way it is at the moment, I think it's a benign growth that's nothing to worry about, OK? Like a wart-like growth, OK? However, the only thing that concerns me about is the rapid growth.
Oh, right.
OK, because that can be a worrying feature. And like you say, where it is...
It's going to, if it does get bigger, it's going to come right into my sight.
Yes, it's a tricky one because for benign skin lesions, there isn't any funding to have them removed.
Oh, right.
Because the NHS, as I'm sure you're aware, has limited amount of funds. So what we need to do is keep an eye on it. Maybe come and see me in another month and I can see how it's changed.
Right.
OK?
Yes.
As an alternative, if you wanted to have it removed, you could always consider having it removed privately if you wanted to.
Oh, right. Well, it's not causing any bother at the moment, you know, that's the thing.
Yeah. So what I'd suggest, if you don't mind booking an appointment to see me again in about a month, so I can have a look at it again.
Yes, definitely, I'll do that.
Okay.
See you in
a month.
Right.
Okay, bye-bye.
Thank you.
Angela Maggs, please. Yeah. So it's been about a year since I've seen you, hasn't it?
Well,
yeah.
For the first time in a long while, I woke up. It was about 2 weeks ago, and had a terrific nosebleed for nearly an hour.
Oh dear.
It was like clots
coming
on things.
So it
and
stopped in about an hour, did you say?
Yes, and I haven't had them before. So that concerned me a bit.
Okay.
The other thing, every so often I have sort of a small light thing dazzles, and then a triangle sort of shape of colours, and after about 20 minutes it's gone. I've got a bit of a muzzy head afterwards.
Does it matter whether you close your eyes or not?
No, because I've tried to work out which one it is, but there is epilepsy in my family.
Okay, so you're worried it's something like epilepsy?
Yeah. Well, I don't suppose it. I hope not.
I must say, from your description of it, that sounds much more like migraine than anything else. And you can get the visual symptoms of a migraine without the headache.
Yes.
And that's what it sounds like to me. Angela has been under my care for 10 years, but she very rarely comes to the surgery. In fact, she keeps very good health herself. However, she is the main carer for her husband, who sadly has dementia. And how are you coping with your husband, is it? How's it going?
He doesn't always realise he's in his own house sort of thing, and gets very confused in dressing. But he's been a very good husband and stepfather to my daughter, and the grandsons think the world of him. And if it was in reverse, I'm sure he would look after me.
Do you want to have your flu jab today?
Oh, yeah, if I can, please.
And could you give David a flu jab while he's here? Because we missed it yesterday.
Have you had yours?
Yeah, you gave me mine. I was your first patient.
I'd forgotten that. You're still alive, so... Yeah.
Flu injection.
So I'm just going to put this into your tattoo, if that's all right.
I always get a very stiff arm, put this. I'm worse than the children.
Little scratch.
You ready? Little
Yeah.
scratch. Sharp scratch.
Oh, isn't too bad at all.
We did 200 flu jabs at lunchtime yesterday, which is not the most we've ever done, but it did look pretty busy.
Oh, one thing. Hold on. Flu jab.
Oh, yeah. Oh, what a shame. I probably got away with that one.
I want to just have a quick look up your nose. Can you tip your head back slightly? I'll put my glasses on, I'll see better, won't I? OK, sometimes in these situations you can see where the bleeding came from, but I can't in your case. Just want to shine a few lights in your eyes a second. So just look at me, please. OK, can you look at my finger, follow it over here, up here, down here. Do you see double at all when you do that? No. I'm going to look into the back of your eyes. OK, all right. Light's coming on rather bright.
Yeah.
There we go.
Thank you.
So let me just say about the nosebleed first of all. Can't see anything terrible going on up your nose. Your blood pressure is normal. Normally in these situations it's a one-off. So I did a brief examination there. I don't see anything immediately wrong with your eyes. So I think it's migraine. It's nothing to do with epilepsy. OK.
You've been very understanding, and I've taken a lot of your time up,
No, you're
Dr.
taking
Cordell.
exactly 10 minutes, which is what's allocated. That's fine.
Yeah.
OK.
Well,
So,
I find you very easy to talk
OK.
to.
Well, have we covered everything for today?
Yes.
Yeah.
Yes,
Okay.
I'm sure I have.
Do keep in touch with your husband's surgery, though,
Yes.
about the other, other business.
I know it doesn't help, and it makes things worse. But on occasions, usually in the evening, I have bellowed and screamed at him, and I thought if I didn't, I could murder him. He could, and I say, "Oh, I'm sorry, Derek."
Hard, isn't it?
And I said, "I know it's not your fault. You can't help it, and I can help my attitude to you, but it is hard sometimes."
It's extremely stressful, isn't it, looking after someone who's got that sort of problem.
And you know,
I think most people find themselves getting very stressed at times. So,
well, thank you very much for seeing me, Dr.
All right, OK. Now, it's been a year since I last saw you. Do come earlier than this if you need to another time.
Well, thank you very much for seeing me. You're very good.
Bye-bye.
Thank you. Goodbye, then.
What time's the appointment?
Well, I thought it was 4:15, but he reckons it's 4:45.
Oh, right.
Honestly,
Yes.
we're really confused.
All right. And your name is?
I'm Dorothy Nichols. At least I know that a bit of me.
That's good then. Good start then.
You have to sit there. Sit
sorry,
that one. That's all right. You can sit there
I'm
if
not
you like.
taking over, no, thank you very much.
No problem. We could do it that way round for a change.
Oh, no.
How are you doing anyway?
Good and bad, good and bad.
Oh, okay.
I'll give you the good first.
Yes, start with the good. I like that.
Blood pressure, that covered quite a period because there's a week I was away and we've improved a good deal.
So ideally we should be sort of 140 or less, but
That's
we're
right.
getting there. OK, so that's the good bit. So
Now, the thing that's not so good, I've been very tired for quite a long time. I blamed the flu, and then I blamed all sorts of things, which I was putting down to age more than anything else
bless
for a very
you.
long time. Now, over in Ireland and Knock, I brought you that. You can, when you've got time, you can read it, see where I've been.
Bless you.
Don't worry about it. It's a little village in the west of Ireland where I worked, I worked for about 4 years before I came over.
So you went back there
And I was back there for a week, going down the high street, when my doctor, Dr. Murray, stopped this car and he came
what are you
across
doing
me.
here?
That's right. And he asked me how I was getting on. But I said, I do feel an awful lot of tiredness. He did say, has anyone ever said anything to you about sleep apnea? I said no, but he said it's more common than we sometimes think. And of course, I did a Google, as we all do these days, and there were a couple of things that did then worry me. One was waking up at night. I wake up to go to the bladder troubles once, sometimes twice a night. But sometimes I have woke up panting. The second thing is a very dry mouth, and it's not a thirst. And the third thing is the legs. It isn't pain, it's more or less a jungling of the legs.
OK. Do you know if you snore?
I don't really know.
Because obviously with sleep apnea, the key is that you're snoring, but you're also kind of breath holding or whatever. And we're not going to be able to get that evidence from you of somebody saying, or, you know, if they're in the same bed with you, they're going to notice that, and they maybe could even time, you know, how long if you were holding your breath. So there's a bit of uncertainty there. There's a score that we could do once we've checked your blood test. There's a score called the Epworth score, which will tell us what the likelihood is. We don't just go by that, but partly it's about the snoring, but it's partly about exactly, do you fall asleep when you're talking to people, or is it just if you're watching a sort of film and it's late at night, then you might fall asleep sort of thing? Or
I should wake up refreshed, he said, irrespective of my age. That's the key.
No, you're right. But the blood pressure I'm pleased with.
Thanks very much, Doctor.
OK, nice to see you, and thank you for your bookmark. I shall keep that in me BNF. Every time I look at a different medication, I'll think of you. OK, cheerio.
Thank you, bye-bye.
Come and have a seat. OK, so your MRI, it shows a lot of changes, as we thought, in the neck. Lots of disc bulging in a number of levels. And there's narrowing in the canal as well.
Yeah, but...
Yeah.
Yeah, we knew that because that's what's trapping the
Yeah,
nerve.
that's right. And lower down on your back. So do you think you're coping with the pain?
Well, most of the time, I get days where I can't do anything.
Yeah.
Because even my hands now,
Yeah.
I get days where every time I pick something up, it drops.
Any numbness or tingling in the fingers or the hands?
I get tingling in my hands when I pass water.
OK. Not sure why that is. You
Normally.
squeeze my fingers.
I got strength there.
Yeah, good. Pull me towards you. Good. Push me away. Yep, that's good strength. Yep, let me just get my hammer. Can I just check your reflexes?
Yeah.
Yeah, just relax. OK. So, I mean, one of the thoughts is, do we need to do anything about it at this point? Have you ever seen anyone about your neck?
Well, I went a few years ago.
Yeah.
And they gave me physio.
Right.
The exercise they was giving me, I was in agony when I with it.
Yeah. I mean, the other alternative is we could refer you to the spinal clinic, see if there's anything they can do about the neck problem.
It depends on what it involves, doesn't it?
Yeah. I mean, we could ask their opinion if you wanted to.
Yeah. I suppose that might be an idea.
Yeah. Should we do that then?
Yeah.
OK.
Another thing is this ear, it keeps going deaf in it. And I did what you told me not to do and put a blood in, and I've never got so much stuff out of my ear.
It doesn't matter, though. It's healthy to have wax in the ear.
Yeah, You can't hear anything now. We're stone deaf without you. If I
We'll
went
put drops in it then, because remember the earbud got stuck in it last time,
yeah.
and I managed to get it out, but another time it might get stuck and we couldn't get it out.
If I go like that,
Yeah.
can't hear anything.
Okay, well, don't go like that. Have we referred you for hearing?
I got hearing aids.
Right, yeah. But you haven't got them in?
No, when I'm on 1-to-1,
Yeah.
I get no problems.
Okay.
Is if I'm in company
Yeah.
and you get a bit of a rabble,
Yeah.
I can't decipher it. So
Okay.
if I got the things
Right, okay.
I'm all right then.
Fine, okay. But please, please, please
Don't,
don't put any earbuds in. Okay. All right, so I'll refer you. See you soon. All right, bye-bye.
I got a blockage, loss of hearing in my left ear. I think it's only wax, probably. First time ever, but it always comes. 91 years, not bad.
It's a sit and wait service, though, so there could be quite a wait.
Sorry.
There could be quite a wait.
Okay, yes, that's fair enough. Good to see what I'm talking about.
Yeah.
I can hear me this one, but not that one.
John Webber, please.
Oh, yeah.
Come on in, come and take a seat.
Can I take my coat off, if you don't mind?
Yes, no, that's not a problem.
Thank you.
Do you want to pop it behind the chair? Is that okay? Or you can hang it up on the other...
John,
You can put it on the peg if you like.
No, it's all right, it's done.
You're not wearing your designer coat then today? Don't care about that one. OK.
I had to sell that one.
Have you heard from the vascular surgeons at all about the vascular clinic?
No.
No appointment yet?
No.
OK. There's some things that are showing up when you had the Doppler studies or looking at the vessels in the legs.
Yeah.
And that's why I've referred you to the vascular surgeons.
Oh, I see, yes.
Who are the specialists who look at the pipe work.
Yeah.
He come in and had his pulses done last Wednesday.
That's right. You saw Sue and your blood pressure's good.
Yeah.
Well, she said it was all down.
No, it's OK, 123. It's a little bit, I mean, how do you feel on it? When you get up, do you feel giddy or anything?
A couple of times I've been like that, like, you know.
Friday, we were out and I took him home.
It's been happening. It's been happening when we're out somewhere, like.
He wasn't as bad as when he was taken into hospital, but he was going that way.
Because of the feeling as if you're going to faint and the blood pressure reading, what we're going to do, we reduce the bisoprolol down to 1.25, and I'll just give you some of those.
Oh, I see, yes.
And maybe check the blood pressure again in 2 weeks after being on it.
Oh, yeah.
Right.
Yeah.
Is it all right if I give that to your wife here?
Yes, of course, yeah.
OK.
I don't know whether you'll agree with it or anything. When I get a packet of tablets, I take them out of the case and put them in a bottle. Does that affect them in any way?
Would you prefer if we set up your tablets in a Dosset box?
Whatever that is.
So you get this kind of pack, a blister pack, and it has all your tablets to take at what time, and you just take them and on the days. Would that be easier?
Well, not really, no. I mean, I've done it myself to try and make it easier. I take the tablets out of the containers, in a sense, and put them in a little bottle, like, you know. So that when I want to take one, all I do is unscrew the bottle, take one out, and gone. Like,
But then we don't know what you're taking when.
Oh, I know. I have them in the mornings, like, you know. I don't take them any other time.
Night time.
I think if you've got your tablets,
Yeah.
it's better to keep them in the packets that they are and take them as you're supposed to. All right? Good. Nice to see you both.
Yeah.
All right,
Lovely.
good.
Oh, there you are.
I'll get you your coat now.
No, don't worry, sweetheart. That's all right.
Thank you.
Margaret Staining.
Come and have a seat. How are things?
No, not so good. I tried the martesipan, but I'm afraid that knocked me flat out.
Okay.
I was
So didn't get on with it?
No. I was like a zombie. And I thought, I can't be like that.
Yeah, because we've talked a couple of times about how things are really getting you down.
Yeah.
And it seems
yeah.
like that's ongoing.
It is. It's just me. I've got to learn to live with things. And it's very difficult.
Yeah.
It's very difficult.
You mentioned that things were a little bit up in the air with with work?
Oh, no, the church is absolutely fine. There's nothing wrong there. It's just me. It's just me.
Yeah.
And I got to learn to let go. And I'm finding that very, very difficult.
How do you think we could make that easier for you?
What, the letting go?
Yeah.
I don't know. I think that's to do with up here. Some days I'm absolutely fine, and another day I am absolutely wretched. But I know I can't go on much longer. I've got to be honest with you.
Have you done anything that you can think of to injure it?
No, only playing golf. I play 27 holes a week.
So what kind of things do you like to knit?
Cordies.
Yep.
You know, anything. I've knitted all for the grandchildren.
I knit, but very, very slowly.
Am I right in thinking you're a ballroom dancer?
Yeah, we could be competition dancers, but it's too expensive.
But as long as you enjoy it and it keeps you
We
fit.
enjoy it, we
and-
do, we
yeah,
enjoy it.
Absolutely.
So what have you got planned for the rest of the day?
I watch a lot of television. I got a dog and he likes playing ball.
Aww.
He's always busy. I do the aqua aerobics and he does the walking.
I still put that there swimming.
Great.
Twice a week. Mine, I do more talking than...
More talking than swimming.
Brian Lovell, please.
Hi, here we go.
Hello, hello.
Good evening.
Have a seat.
Hi, thank you.
How are things?
Pretty good, I reckon.
I like to hear that.
Yeah, everything seems to be, well, I just carries on as normal.
Yep. Any problems?
Not that I can think of.
Don't have to try and look for them.
No, no.
So getting about as normal, going on your holidays?
Exactly. The only thing, I've tended to slow down.
No.
Playing football. Yeah.
Who are you playing football with?
Only the grandchildren.
Yeah.
So it's now got to the stage where Grandad got to play in goal.
Keeps you fit then.
I'm a great-grandfather,
Right.
really.
Yeah.
And the other great-grandfather died a couple of weeks ago.
Oh, I'm sorry to hear that.
And the youngest one, the 8-year-old, I've told him I'm slowing down playing football.
Excuse me, yeah.
Told him because I got a bad leg. So he said, if Grandad gets his leg fixed, you only got 14 years to go and you'll be 100.
Thanks for that.
Yeah. No, what can I say? I just feel that I'm lucky.
Absolutely.
Yeah.
Yeah. So, can I just check your blood pressure? So, any chest pains? No. Breathlessness?
Only if I run too far.
Yeah, well, that's fair enough. Yeah, perfect. Right, okay, so just book for a routine blood test when you've got a minute, fit it into your schedule. Fantastic, well, nice to see you.
Yeah.
Keep playing football.
I haven't seen you
I know.
long time.
I know.
Anyway, thanks for that.
No problem. You look after yourself.
Okay, thank you.
Okay.
It can be really hard when you're looking after someone else as well as looking after yourself, and then you also have work responsibilities which are...
I enjoy it.
Yeah.
It's my life. That's my solace.
We stopped the mirtazapine. Do you think we should restart the Sulapin then? Because we've stopped prescribing it for you.
Yes and no.
Do you want us to restart it? Because we talked about the potential risks.
This is it, but I don't know what the potential risks are.
When compared to other antidepressants, it is possibly more, puts you at greater risk of heart-related complications. So the options are not being on a medication and thinking about other strategies, talking-based treatments, for example, maybe some counselling, something like that. Trying a third option, a different antidepressant, or going back to it and accepting maybe there's a slightly increased risk.
I don't know. I really don't know. It's all I know is I can't go on the way I'm going on.
Yeah. I guess we have to make a decision, don't we?
Well, what would be the other one you were thinking of?
We could try something called sertraline. Why don't we give that a go?
Stupid I am, really.
There can sometimes be a reluctance amongst older people to talk about their mental health. In the past, there has been a stiff upper lip attitude and the feeling that they were wasting their doctor's time by coming and talking about how they're feeling. My advice is not to suffer in silence, but to come and speak to a doctor about how they're feeling, because there's lots of support which we can offer. Why don't we give that a go? If we're not making headway, then we think about something else.
Okay.
If you could perhaps book an appointment in about 3 weeks to catch up again?
Okay, thank you very much. Sorry about this.
No.
Bye-bye.
Bye then.
I was up at Tesco's and nuns were outside, so I give them £4 each. She held my hand and said, "Oh, you have a nice day." I thought, oh, she goes backside, and I went to Euro tonight.
All right?
Yeah, fine. Here we are.
Come on in there.
And I brought my hat in case you wanted to put a patch on top of my head. But there you are.
And how are you? How's your head? Oh, it's looking better, isn't it?
Oh, good.
It's drying up.
Good.
Oh, at last.
Yeah, but it was weepy,
See, all this is lifting off now. It looks nice.
Is it?
Yeah.
Is it skin cancer?
Well, I don't know. What do they tell you?
Well, that's what they said down the BRI about 20 years.
20 years ago?
Yeah.
It was known you men are known for it, you see, because you haven't got much hair, have you, on the top of your head? So you men should always wear a hat, really.
This is the best one, look, because it covers my ears as well.
Have you always worn a hat?
Only when I was on the buses.
On the buses, yeah. Yeah, I don't wear them anymore, do they?
No, I don't never see them now, do you? Not the inspectors.
No. It's quite dry. I'm quite happy to leave it open.
If you leave it open, that's the best treatment for it.
Okay, fine. That's fine by me.
I got to see the cardiac rehabilitation counsellor.
Oh, right.
Sounds good, doesn't it?
Have you seen one before?
Twice I've seen her. She's nice.
Okay. And what do they do?
Trying to get me to find some activity.
Is there anything that you've seen that you'd like to do?
Tai Chi, I did that. That was nice. I made everybody laugh.
I expect you did, knowing you, yeah.
When they said to take like that, and
that reminds you of our Latin American dancing classes. Remember those?
I can remember the square dance.
That's great. Right then, I'm going to see you Thursday then. Oh, it looks lovely.
Oh dear. Oh, me stick.
your stick.
Don't forget me stick. Thank you, sweetheart.
That's all right. I'll see you Thursday then.
Okay then.
Behave yourself. I love seeing the older patients. They've usually got a story to tell.
Beep, beep.
You're doing very well, actually. The most rewarding thing about treating the older generation is that you learn a great deal by hearing their life stories.
Well, I've been a bit worried about it because it didn't clear, so I'm pleased I've seen you now.
I just recommend that you keep interested and keep curious, maintain friendships and pass on your wisdom to the next generation.
I intend to grow old disgracefully.
Good morning, Holford Health Centre. Can I help?
When she's asleep, she's breathing really like like that kind of thing.
He needs to go to the hospital. He needs to go to A&E.
He stops breathing for a while and then does a huge gasp.
I'm gonna be a doctor.
Well, I hope you have somewhere to sit when you're a doctor.
Treating babies and young children is actually my favourite bit of general practice.
The way they tell their stories can be very entertaining and it brightens up the day.
All parents worry about their children. I'm a parent. We all worry about our children. And I think seeking reassurance and guidance on the fact that we're doing the right thing is helpful to all of us.
Danielle Winter. Hello. Who have we got here?
This is little Harley.
Oh my goodness. Fast asleep and looking happy. Come in. It's a warm day for little one, isn't it? Oh. So, shall we start with you?
Yeah.
So, how did the birth go? Were there any issues or problems?
No, the
or
only
anything?
thing, just halfway through, we decided I need to turn around. So it was, I think it's called face presentation,
Okay.
is it?
Oh no, it's
so that
hard
was
to get out then.
Yeah, so that was the only thing, and it took a while. But apart from that, everything else went okay.
Perfect. And in terms of your bowels and waterworks, everything
all of
okay
that's
there?
fine,
No
yeah, all of
troubles.
that's fine,
And down below,
all fine.
feels all right. You didn't have any stitches or
No,
anything
no
though,
stitches,
so
nothing.
perfect. Well,
Yeah.
you're a natural, obviously. And how are you feeling in yourself? You
Yeah,
look
perfect.
well enough. Are you getting
Yeah.
some sleep?
I'm getting- he was
Or?
a bit naughty last night, but apart from that,
Okay. And feeding-wise?
Feeding-wise, he's feeding a
Feeding-wise
lot.
is fine. He's taken to the bottle all right?
Yeah.
Perfect. So any concerns about him?
About, I think it was a couple of days ago, he did a complete solid pill, and it was really long, and it had blood in it. And I was a bit like, oh gosh. 5 minutes later, he just did a normal poo again, and he was completely fine.
Did that coincide with him going onto formula?
No, it coincided with him going on to an anti-reflex formula, and I didn't know if that was anything to do with it.
Probably, yeah, might be the
So I
change of
swapped
milk.
back to the colic and constipation one, and the poo was back to normal.
Yeah.
But,
So can we have a little look at him? I'm so sorry to wake him up. Oh, look at him. Oh, look.
There we go.
Hello.
Take this out.
He's like, what are you doing to me, mother? What are you doing? I was fast asleep. There we go. That's that
right?
Yeah, that's fine. Where's your eyes? Let's have a look. Oh, yes, that's brilliant. Oh, I'm sorry. Is that a bit bright, was it? There we go. All right. Shh, 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 shh. Good boy. Hello.
There you go.
Gosh, he's strong.
Yeah, he was holding his head up for about 3 weeks. I was so shocked.
That's fine. Let's check your boy's bits. That does look like you might need to do a wee, so we'll stand back if we need to. That's fine. Both his testes are down. Let's check your legs. Have you got your red book anyway?
Yes, I do. It's in my bag, in the big bit, yeah.
Wow.
Oh, we don't like that side face, do we?
Oh, I don't blame him. That was a bit mean. So, have you got an appointment for his injections yet?
Yes, I have, yeah.
Fine.
Yeah.
So, are you okay about having those?
Yeah,
Obviously,
that's
none of us
fine.
like to have our
No.
babies jabbed, but they'll explain to you when you come along. And sometimes they can get a little bit of a temperature or be a bit grumpy,
The
so
health
you're
visitor
allowed
said
to
last
give.
week.
He's really gorgeous, aren't you, pretty boy? You are. We can say that when you're a baby, not when you're 18. We won't call
No.
you pretty then.
Oh, thank
Take
you very
care.
much.
Yeah. Lovely to meet him. Bye.
Yeah, all right.
Hello.
Hiya.
Hello. Very good, so it is. Are you Cody?
Yeah.
Cody, who's this?
Mummy.
Mummy. Very good.
I brought him in a few months ago because his willy didn't seem to be growing with him.
It doesn't.
No, it doesn't seem to be growing at all.
No, it won't grow until he's about 11.
All right, okay. But he's been complaining it hurts quite a lot.
That's different.
And also his bum is also red raw.
Does he scratch it?
He's always irritating him, yeah. But he's just for the last 3 days now, he's been complaining that his winky hurts. He calls it his winky.
Cody, what I want to do, please, is to have a look at your bum and your winky. Is that all right?
Yeah.
So now you take your trousers off. All right. OK. Now, well, what I want to do, sweetie, I'm going to put you up on the bed because it's going to be easier for me. Here we go. All right. So first of all, we're going to look at your bum. Oh, it's scratching here and here.
Yeah, it's all around here as
It's
well.
very dry, so actually I'll give you something to put on there.
Okay.
Where does your winky hurt? Can you show me? It's a bit tight.
Okay.
That penis is perfectly all right for size.
Right, okay,
At
yeah.
his age.
Good boy, do you want to get your shoes on?
Careful, careful. Not my... Those are my keys.
Cody, can we get your shoes on?
Sorry.
So that's very nice of you to say sorry. Thank you. Where am I going to sit now?
Nothing.
I was going to give him some steroid for that skin, but actually what I'd like to do is just some moisturiser. It just feels dry.
Yeah.
And if you put some moisturiser, it may just make the itching go away.
Okay, yeah.
I'm going to be a doctor.
Well, I hope you have somewhere to sit when you're a doctor. You can use this as much as you want, so I would put it on 2 or 3 times a day.
Okay, lovely. Come on then. Are you taking your picture? Right, say thank you.
All right. Bye-bye.
Right, thank you. Say bye-bye then.
Bye-bye.
Bye-bye.
Thank you.
Polly, please. Come on through. And your grandmother?
Yeah.
Yeah?
Yeah.
OK. And Polly's how old now?
Coming up 4 months.
Yeah. And how can I help?
She's worried about her eyes. This eye, she'll open it really, really big and it looks bulbous.
OK.
And you can see all the white right the way round it, and sometimes the eyeball will sort of tremor a little bit.
And how long has Mum noticed this being a problem?
Well, when she was born, she had quite bulbous eyes. Do you know?
OK.
They were quite thin, but they settled down. We put it down to pressure and what have you, but about the last month,
About the
6
last
weeks,
month.
that she thought it was settled, but it haven't, and it's, like, a bit worrying.
He keeps getting the gunk come in his eyes. He's waking up with his eyes stuck together.
Just picked this little one up from nursery. I think there's conjunctivitis going around.
Yes.
So she's suffering a bit.
In his left eye, it's watering on its own, comparatively swollen and red, kind of.
And it's past in the morning. Yeah. And is it itchy? Yeah.
And is there anything else that's happening at that time? Is any other limb shaking or anything like that?
Not that I've noticed.
OK, all right. And how's she fed at the moment? Is she bottle fed or
Bottle, yeah.
And she's taking all the bottle
Oh,
feeds?
yeah, she's a greedy moo.
And nappies are all OK? Is it
Yeah.
both the eyes or the right eye?
It tends to be the right eye, but
OK.
the left eye does it, but not very often. It's more of the right one, and sometimes it's squint right in.
OK. And is there any family history of any eye problems?
I've got eye problems myself.
Any squints in the family?
Yeah, I had bad squints. I had surgery on them.
OK.
Yeah, she's just generally worried about it.
All right. So let's have a look at Polly. If you pop her out and bring her onto the couch there, I'm just going to wash my hands before checking her. And no vomiting or anything like that?
No, nothing.
OK, so if you pop her up here. And no discharge from the eye?
No, none.
No. No, let's just have a shine a light in here. You're very cute, aren't you? We've got the eyelid on the right just seems a little bit lower compared to the left. And there might be a slight inturning of the right eye. Fine. And apart from that, she's absolutely fine in herself?
Yeah. Yeah.
Fine. OK. Pop her up and let's have a look at her while she's sitting in your lap as well. That would be helpful.
Come on, then. Oh, come.
Let's just have a look here. So what I'm going to do is get what's called an orthoptist or somebody at the eye hospital who specialises in checking children's eyes in a bit more detail.
Yeah.
Is that OK? The letter should come through fairly quickly.
Oh, good.
So you've got her all day, have you?
Yeah, Mum's gone to work.
Right.
Gone back to work already.
Take care.
Thank you very much.
Bye-bye.
Thank you, bye-bye.
I gave birth less than 4 days ago.
Fair enough.
You're looking very well, I must say, considering I know what you've gone through. OK, so any hyphens or anything in between Clementine Butler? No?
Just 2 separate surnames. One of them is Butler.
No.
What?
2 separate middle names.
Yes, what I meant.
Okay, it's not what you said.
Baby brain, we can allow
Yeah.
baby brain, yeah.
Hi there.
Hi.
OK. I wondered if you wouldn't be coming because I saw that the little one had been off to hospital. Was
Yeah,
that
on
right?
Monday. Yeah,
Yeah.
he was. Yeah, but I think
He's bounced
it was
back,
just
has he?
precautionary. Yeah, just in
okay,
case he's little.
Yeah. OK. All right.
Yeah.
So you enjoying being a mum?
Yeah, I think it's quite challenging. Yeah. Just because I obviously don't really know what I'm doing, and I was saying to my husband yesterday, in the day I don't know if I should be doing more for him because either he's eating, sleeping, or crying, wanting to be fed. I don't know if there's anything I should be doing to stimulate him.
What more could you do?
Well, I don't know. There's times where I just think, OK, you're awake now. What should I be doing?
Just, I mean, interact and
Yeah.
do as much. You just grasp those moments and do what you can, really. And then, but, yeah. I mean, the time will come when you've got a little bit more time. But so you went into hospital on Monday.
They just observed him and then they sent us home again. So
OK. Has his breathing gone back to normal? It looks OK to me.
yeah, he's definitely breathing a lot better.
Apart from having been in hospital, do you have any other concerns about him?
Only just about his head, actually.
Yeah?
We've noticed that his ear on one side is further forward than the other. We asked about it at the hospital on Monday and they just said it is because he is leaning on one side more than the other.
OK.
And he's flattened his head.
So they were relaxed about it and said it was...
Yeah, they had a good feel of his skull and said nothing seemed abnormal, but
Yeah.
said they said it was worth mentioning to you when I saw you.
OK.
So, yeah.
Right then, hello, mister. How are you? Who's mum?
I'm Mum.
Your mum, OK. Do you want to sit on mum's knee? And then, are you Nan? Yeah, OK. Presume so, but you couldn't get that so wrong. OK, right then. And so this is Jonathan. Hello, Jonathan. How old are you?
4.
4. Quite a big boy, aren't you?
Yeah.
That's good. OK, so he's eating and drinking right. He's been to nursery.
No, I didn't take him today.
Right, OK. Who's drawn the pretty pictures around it? OK.
See if we got any bigger.
Right then, let's just turn you round a bit, mate.
Because he seems to be more appearing up.
OK. Are they itchy?
No.
Are you scratching them? No, not at all. God, they look itchy. I want to scratch them.
No, we haven't touched them
Okay.
at all. It concerns me.
Yeah. They've all got a central punctum. They've got one there. There's one there.
Yeah, they've all
got it.
Yeah.
Yeah. OK. All right. You don't know what it is. Anybody else got it?
No, just him.
OK. New medicines or anything?
No.
OK.
He's took his Calpol.
OK. I can't put a name on that. OK. It may be bites. Children do come in and see us with rashes all the time. Most rashes are completely harmless and will just get better by themselves, in fact. And he's quite all right, playing... OK, all right. Of course, every parent worries about the rash that can be caused by meningitis. Meningitis is a rare condition. Each GP would only see 1 or 2 cases in their career. Parents should worry if their child has a rash and the child is not very well. The rash of meningitis is red spots on the skin, and the important difference between meningitis and most other rashes is that the spots do not fade when you press on them. You can stick his top back on and just keep an eye on them, OK? Yeah. A well child is a well child. It'll probably just disappear by itself, OK? If it doesn't, or he gets worse, you bring him back. OK?
That's fine.
Is that all right?
Yeah, that's
Thank
fine.
you very much. We won't put anything on. I'm surprised they're not itchy.
Yeah, that's what I said.
You know they don't itch. OK, bye-bye.
Is he smiling?
He'll smile just really randomly, it doesn't look like it's a result of something that we've done. He just seems to smile.
He's 6 weeks and 1 day, so it's a bit
Yeah.
It's right on the borderline, isn't it?
Yeah.
You happy with his eyesight?
He's definitely tracking us when we move around, and he does look at things that are making noise, but not all of the time.
No.
So I wonder about his eyes.
Do you want to get him out of there?
Yeah.
And I have him up on the couch to examine him.
Oh, yeah.
So, you're absolutely right about the ears. One appears to be further forward than the other. And I'm sure the hospital is right. It's because of this asymmetry of the skull, okay? Which is a common thing. And I imagine that this is just going to settle itself down over the next 2, 3, 4 months, actually. We'll have him back and have another look at that.
Yeah, that'd be good.
It's extraordinarily uncommon that we need to do anything about
Okay.
this. So what we're doing here, this is obviously not a full eye check, but what I'm doing is just checking I can see down to the back of the retina.
Oh, it's okay.
You're a wiggly boy, aren't you?
Oh.
So, eyes are moving, they seem to be moving together.
Yeah.
Pupils are the same size, and there's a clear view down to the back, so we don't think there's anything like a congenital cataract that would be obstructing vision there.
Okay.
Okay.
You find your thumb again.
Hey, Ralphie. Hello.
Doing a fake crying now.
Yes, you are, aren't you? Let's just have a look at your spine. It's a nice mobile spine. OK, lovely. Dress him up. I'm just going to jot a couple of notes down while I remember them.
It's okay. There we go. It's all done.
He's a lovely boy, isn't he?
Yeah. When he's calm.
When he's calm.
Yeah.
It's always nice when they're calm, isn't it? And listen, I should see him again, all right? Need to check that he's smiling properly, which almost certainly will go with following with his eyes as well. Those two things tend to go together. So if you can book an appointment for him to see me in 1 to 2 weeks.
Okay.
All right, Alfie? Time
Into
to go.
your chair. Uh-oh, chair time. Let's see how we go. Thank you.
OK, you're all right. Let me do the jaw, because it's quite heavy.
Thank you very much. See you again.
So you book that appointment on the way out.
Yes, I will
OK,
do. Thank
cheers
you.
then. Bye-bye.
You ready to read it? Okay, here we go.
Little fish.
Much longer. I don't know, that's why I bought your book to read.
I'm Dr. Graham. How can I help?
We've been on holiday for 2 weeks, and while we was away, she was complaining her ears were hurting.
Yeah.
I had an audiology appointment with her today.
Yeah.
So we went down there, and he said that her right ear is blocked.
Yeah.
And the left ear, it looks like something going on infection-wise.
Right.
And he says that I needed to come and see you.
And do they hurt both ears at the moment?
Which ear hurts, Robin?
That one.
Yeah, the right ear.
Does it hurt if I press here? Does it hurt at the back? The ear canal is quite red and there's a bit of pus in there.
Right, OK.
So she might have had an infection behind the eardrum that's burst.
Right.
And then left some
gunky
stuff in the canal. Should we look in the other one? For you to stand up, I think it'll be easier for me to get around it that way.
OK.
And this one, if I press here, does that hurt? And that there? Nope, good. I would actually say that one looks pretty all right.
OK.
She needs to have some antibiotics for that side because that's an infection.
That's the side where she's got mild hearing loss in?
That side?
Yeah.
OK. Is she allergic to anything?
Not that I know of, no.
So we normally give amoxicillin, all right?
OK, yeah.
So this is 1 spoonful 3 times a day for 5 days. She should probably keep the ear dry, maybe for a couple of weeks till it's fully better. Is that all right?
Yeah, that's fine.
Good.
Who do I need to see about speech and language?
We could talk about it now if you want.
Yeah?
Yep.
She's very still learning to pronounce words.
Yeah.
So she can't say things like her brother's name is Jackson.
Yeah.
She says Jack's done.
Yeah.
So her development in school is perfect.
OK. Does the teacher have concerns
No, they
about
haven't
it
said.
at all?
No.
So it would be worth talking to them because
Okay.
there's a very wide range of normal and a small problem like this, when everything else is fine, will sometimes just improve with a bit of practice. But if the school is concerned and thinks that she might benefit from speech and language, then they might want to write a small report, OK, to us. How does that sound?
Yeah, that's
Is that
fine.
all right? Because it
That's all right.
sounds like otherwise she's doing really well. And at her age, it's all right to get quite a few things slightly wrong.
Yeah.
Is that OK? Good.
Right, say bye. Say thank you, Dr. Graham.
Bye.
Bye.
Ezra.
Oh, yeah, sorry.
Come on in, come and take a seat.
Thank you.
I'm Dr. Ahmed. Okay, so how can I help today?
Well, basically, he's been sick every morning this week, and once in the evening, which was yesterday.
So when did the sickness start?
It's literally been like a week. I've not really took notes because I thought, you know, babies, they are sick, so...
So vomiting started...
Yeah, I'd say roughly about a week, but it has been noticeable because it's not normally his character.
Okay. When he's been vomiting, has he been vomiting every morning? Or throughout the day?
No, it's normally just the mornings.
So it's just once a day, usually?
Yeah, yeah.
Is he taking his sort of solids at the moment?
Yeah, but he refused breakfast the other day, so I had to just leave him, but I've been trying to do little and often.
Any temperatures?
No, not that I've noticed.
Okay.
He has fell a couple of times on his head.
For the past sort of 2 weeks at least, he's had this really chesty cough.
He's literally just had a cold and his cough has turned really, really chesty.
She's got chesty cold, so she's not well, she's not sleeping, she's waking up.
He's been coughing an awful lot.
Okay.
And it's just tiring him out. And this morning, he just sounded particularly crackly. It's not got any better.
Coughing at any particular time?
So all throughout the day.
Yeah. And at night?
Yes.
Yeah.
Where's your doggy?
Tia, please.
Yes. Tia. Here we go.
Hello.
Hello.
I'm Dr. Jewell.
Dr. Joe. This is Tia. She's got a bit of a funny chest, so I just want to check it out. Really.
Okay.
She's been coughing now for over a week, but we've been away, so that's why I haven't brought her down before.
Where have you been?
Isle of Wight.
Oh, what was it like?
Lovely hot weather. Absolutely lovely, wasn't it?
Apart from coughing, has she been all right?
Yeah, she's had a bit of a runny nose a bit, but when she's asleep, she's breathing really like that kind of thing. And then in the morning as well, she's really trying to catch her breath. But then throughout the day, she's all right like this. But
Active?
Yeah.
Obviously very active. Eating all right?
Yeah.
Playing?
Yeah.
Right, let's... She's got a bit of wheezing on this side. Makes life a little bit difficult. Well, it doesn't really. It suggests what we might do about it. 6, 7, 8, 9, 10. That's okay. We all worry about children because we know they can get ill very quickly. Now, the ones we worry about are the ones who are very floppy or pale or not responsive. If they haven't eaten for a while, they've stopped playing, those sort of things. And although we ask questions about it, it's a kind of judgment you make just the moment you see a child. And you make the judgment almost as soon as the child comes in. Is there asthma in the family?
I have it slightly, and my husband does as well, and my son.
So do you have lots of inhalers and equipment and stuff in the house?
Yes, we do.
And you know how to use them? This
yes.
is great. This is fantastic news. I'm sure it's not a chest infection. She's much too well for that.
Yeah, that's right then.
I can hear the wheezing. And as you probably know, people who have asthma, it's worse at night often.
Yeah.
Now, you can't diagnose asthma in a child of this age. But she has got some wheezing, and I think a sensible thing is to treat that.
Okay.
And if you're very familiar with inhalers and things, we could do it that way. Are you happy with that?
Yeah, that's fine. Yeah.
Now, do you use spacers?
Yes, I do.
There's nothing I need to teach you. It's wonderful. Will she tolerate having the mask over her head?
You never know until you try. Right, can I pop you up? We can go.
Now, you know also, if you're treating somebody with wheezing and they're getting worse, that's an emergency.
Okay.
You know that?
Yes.
Thought you would. You're being very kind to me, and sort of pretending, half pretending you don't really know this stuff. Tell me.
No, I do know.
Here's the critical question.
Yeah.
Had you decided when you were sitting out there that what you needed was to go out with this before you even saw me?
No.
You didn't. Oh, well, it's very, very decent of you to say that.
No. Thank you.
Good.
Right,
I hope it does the trick. Good.
Thank you very much.
Bye-bye.
Right, come on. Come on.
It's just on the shelf. There's a train. Yes.
What's this from?
Very important. This patient said, "Where is your train?"
That's so funny.
He has fell a couple of times on his head. I know I'm being a paranoid parent now.
That's
but
all right.
I obviously Googled and was like, the
Okay,
symptoms.
all right. When did he last hit his head?
Oh, it'll probably be a couple of weeks ago. He fell off the bed. It was just straight down onto the bed. It's like sofa level.
That was 2-3 weeks ago, and this kind of vomiting thing's
It's just
not going to be
coincidence, isn't it?
related to
Yeah.
that.
The only other thing I've noticed is, I don't know where because I'm not a doctor, but this is slightly raised. I know he's had that for a while.
Okay. So you're worried about a collection of all these sort of...
Yeah, because when you go into Google, it's like water in the brain, and I'm like, oh my gosh, what have I done?
Okay.
The internet can cause undue stress and concern. It's also a great source of information, but one of the things we try and do is signpost patients and parents to NHS-endorsed websites for appropriate information.
Do you want to just pop his things off?
Yeah, I can do it
right
here
down
or-
to nappy level.
Do both
Mind the
hands
edge there.
together.
Yeah, no, actually, quite a bit actually.
Mobile babies and children are always bumping into things, and this is part of exploring the world that they're in. With regards to head injuries, if a child is acting out of character, for example, more sleepy than usual, or vomiting, or just not being their usual selves, I would seek further advice.
You know, I think he's fine, actually. If he's eating and drinking, there's no vomiting during the day, his nappies are fine.
Yeah.
I can't quite explain this one-off vomit in the morning, but if it's just a once-a-day vomit in the morning, the rest of the time there's no temperature's fine, so on, I think we'll just wait and see.
Okay.
And in terms of sort of lumps and bumps in the head, I mean, his head looks fine here. That's the shape of his skull,
Okay.
isn't it? And
Yay, just a bumpy head.
he's fine in himself.
But yeah, thanks for seeing us.
No, not a problem. Do you want to... Are you okay
We're
doing it
done.
there? Yeah. Become expert at doing that.
You are?
No, I said you become expert.
Oh, right, I thought you said you're an expert. I was like, feel free.
That's
Do you
okay.
mind just-
No, that's all right.
Awkwardly bending his arm
You've
into
got
his
a
jacket.
nice red coat there.
All right, we're going now.
Right, now we have objection.
What's this day for you?
Take care.
Bye.
Bye.
Thank
Bye-bye.
you. Oh, you're normal. Yay.
William. All the way down, yeah?
Here we go, little man. There we go.
Right
Quick, can we come?
Have a seat a minute, and then we'll just have a chat about what he's done. Right then, so it's his 1 year IMS to do.
Yeah.
And he's going to have 4 injections, all right? A booster of his hib, but also with the meningitis C, and then the new one, the MMR, so the mumps, measles and rubella, okay?
yeah.
So it's a live vaccine. 24, 48 hours, may get a bit of a temperature, maybe just a bit off, you know?
Yeah.
Not, you can't do anything right, you know? Not allergic to anything that you know of?
No.
Yeah,
You're
lovely.
going to be a big boy, aren't you?
Yeah, it's going to go in his legs, so 2 in each leg, obviously. Because he's nice, big and strong now. We'll have to keep a hold of him because he's going to get
I've got
really...
2 others, so I've got a 5-year-old and a 4-year-old.
So you know how they get?
Yeah. The eldest was the biggest trouble. He screamed every time he had one.
Wasn't me, was it? No, I've only been here 5 years, so it wouldn't have been me.
And then I bought the middle one for his preschool jabs like 6 months ago, whenever it was.
Yeah.
And he sat and he smiled.
Oh, well, there you go.
I think the nurse was quite amused. Ready? Hold Mummy's hand then. Okay?
Yeah. All right, Mum, you ready?
Let me see it. Good boy. Well done. Good boy.
Is that one?
Well done. You're so brave. Okay, well done. Good boy.
OK.
Well
Well done. I know.
All right. You've got her. We're going to go men B now.
Good boy. Well done.
Plaster, plaster, plaster.
Good boy.
Right, turn around, next leg.
Just get it done when it's just get it all done. Hey, you're fine. You're fine. You're with Mummy.
Ready?
Good boy. Good boy. Good boy. 1 second and we'll all be done.
One more to go. Do well, do well.
1 more second, sweetheart. Good boy. Mummy's got you. Good boy. I know.
All done, all done.
That's it.
Well done. Well done. Oh, so sorry.
Good boy. He's fine now.
Is he all right?
Yeah, he's such a happy little man.
Aww.
He's a good boy. Aren't you? You might have yourself a biscuit when we get home.
Nice.
Have a cup of tea and a biscuit.
Does he drink tea, does he?
Loves it.
Right, so that's everything written up. And I won't see him until he's 3 years and 4 months. Yeah, I'll get the door for you.
Thank you. Come here, then, precious.
All right, well.
Good boy. You're going to say ta-ta? Ta-ta.
Bye-bye. Take care. Bye.
Thank you.
Kaimani.
No. Do anything.
Hello.
Mommy.
Come on in, have a seat. I'm Dr. Graham.
Please don't do that.
When I was poorly.
Just don't do it. Please don't.
What's the matter, darling? You're not having an injection, see? See? The doctor says you're not going to have an injection, okay? All right. How can I help?
Kamani's got ongoing health issues.
Yeah.
He's on methotrexate.
Yes.
Friday will be week 8 of the methotrexate.
Yeah.
2 weeks ago, some of his blood tests came back with bad kidney function. His creatinine levels were 78.
Yeah.
His baseline is 30. So they took us in for tests. So anyway, for the past 3 days, he hasn't really eaten. He's very tired and he's not himself at all.
Okay.
So I'm quite worried.
And he's on the methotrexate for his skin, is that right?
I want to go home.
I know.
You're so brave.
36.7, so that's normal. And I'm just going to listen to your heart to count your heartbeats.
Stethoscope. Molly, there's not going to be any injection, okay? You're not going to have an injection.
I don't want the blood test.
I know you don't. If he needs one of those, can you not tell him?
Kimani is on methotrexate, which is a drug that requires regular monitoring to make sure it doesn't damage your kidneys or your liver. So he has to have regular blood tests for that. He has a number of other medical conditions, which means he has to go to hospital very often to see different consultants. This has made him very scared of going to hospital and why he is particularly scared of needles.
I know you don't like blood tests, my darling. I know. Okay, sometimes we just have to test them.
I'm just going to count your heartbeats, that's all, okay?
Listen to your heart.
So it goes.
It's a bit cold. You're so brave. You're brave like a superhero.
Yeah. Okay, that's fine.
I don't want to be here.
I think he probably needs to go and get some you-know-what's done. Because of the other issues, because the tablet he's on can bring down his white count, which makes it more difficult for him to fight infection, so we need to know what that is. But the fact that he keeps wanting to go to sleep, you know, and he's not eating, he's not drinking very much, and yeah, exactly, so all signs that things aren't right.
I don't want to be here.
Please come through.
Hello, hi. Hello.
Hello. What can I do for you today?
Well, it's kind of a follow-up appointment about Louis'
heart. He gets a racing heart every now and again. There's no kind of set pattern to it. It just happens. And I was asked to take his pulse when it happened because we found it was about 80 normally, and it does double. And I've also got another concern. I'm worried about his sleeping. He seems to gasp a lot. Well,
just like that?
Yeah.
Oh, okay.
He stops breathing for a while and then does a huge gasp.
I hold my breath myself.
Yes. You do when you're asleep. I think it worries me more now because I counted how long.
Yeah.
And it was 12 seconds he held his breath one night.
And does he snore a lot at night?
Yes. We call him Darth Vader as well.
I do that.
That's a pretty good Darth Vader impression. Excellent. All right. And how long have you been worried about his breathing overnight?
Especially worried probably the last 2 months. He's very fitful in his sleep. He'll toss around and wake up a little bit and go back. And some days he's quite tired.
Bless you.
Yeah.
Do you ever get sleepy at school?
No.
You don't fall asleep in lessons or anything along those lines?
I wish.
Oh, really? And have you had any thoughts about what you think might be going on?
Maybe I was worried about sleep apnea. But, I mean, when I was a child, I had a similar thing.
Yeah.
And I think I had an operation when I was little.
So I think that you're probably on the money there, Mum, in terms of what's going on.
Yeah.
I think it's your lymph nodes that you fight infection in your neck. You've also got some in your throat as well.
Yeah.
And sometimes they're a little bit bigger in children than they are in adults. And in general, they get smaller over time.
Right.
As they go into their teenage
Yeah.
years. And in terms of operations and things like that, they only really think about those if they're causing a lot of bother.
OK.
Should we have a listen to your chest? Okie dokie. So I'm just going to pop down the top if that's OK, and I want you to take some really big, deep breaths through your mouth if that's OK. Well done. So that sounds nice and normal. So I'll just check your pulse rate. Perfect. Now, how big can you open your mouth and how far can you stick out your tongue? Cool, blimey. So you do have quite big tonsils. So, absolutely happy to refer. In terms of examining him today, he examines completely normally, but I do hear exactly what you're saying about his heart rate being very quick during these episodes. So again, I'm going to sort of make a doctorate.
What I'm thinking is if he was an adult, we'd do an ECG here.
Yeah.
And I'm not sure whether we'd do an ECG at his age, just because I'm not sure we'd interpret it.
Well, that's the thing, is the difficulty with interpreting, isn't it?
So
Yeah.
I don't know whether... I mean, I'm sure the Children's Hospital offers a means of getting an ECG done.
Yeah, yeah.
And/or whether we make a referral for them to just see him. But it does sound like it's happening at rest, which isn't... You know, we do need to ask the question.
Yeah,
why is
absolutely.
that the case?
All right. So, we will write a letter to the powers that be about you snoring. And we will check in. The best thing to do is check out your heart, OK?
All right, then.
Fantastic.
Thanks very much.
No problem, thank you.
Bye-bye.
I know you don't like blood tests, my darling, I know. So is there any way they could do them here? Doesn't have to be at the Children's Hospital.
I don't want to say.
We won't.
I think he needs to go to the hospital. He needs to go to A&E.
Because
we need to get on with working out what the matter is, OK? I mean, we can do the urine here, but... No, we used to, but we used to have 2 nurses that were paediatric trained, but we don't anymore. So the under 5s, we don't do even routinely. What you can ring whilst you can go home and get the sample done, put it in a pot, yeah. Ring Dr. Mahon and see what he says, and he may say, "I'll see you this afternoon." I don't know, but I'm not sure how much of the problem is to do with a urine infection or not. All right, I'm going to give you a letter, okay? Which nursery are you at?
What nursery do you go to? I don't know.
Do you like your nursery?
What do you like to play?
Nothing.
Would you like to play superheroes? Not today. Can I be Thor? Oh, don't you want to play with me?
I want to go.
Okay, but you may need to go
I guess we
to
probably do need
ED.
some more.
Yeah. All right. Do you want me to put that in your bag? Yep. Oh, you poor little thing. Hey.
So can you get to the doctor?
Okay. There you are.
Good boy. Should we go right home?
That sounds like a good idea.
Let's do that.
Okay.
Thank you.
That's okay. Bye-bye.
You okay?
Yes, thank you.
Oh, right. What we have is, I'm assuming it's this foot. I always forget which foot it is. He stubbed his toe.
Yep.
Basically, he has. It's not that one. I knew it. 50-50 chance to get it wrong. Right. So he stubbed it about 2 weeks ago. His toe is really quite.
Yeah. It's a little bit sore, isn't it?
It's definitely not sore today. But what I don't like is the fact this doesn't seem to be connected to his nail anymore.
How do you mean?
It's all. Yeah.
This is all red and pussy, isn't it? That's the bit
This
that
is
bothers me.
It's not right.
How long ago did you say it happened?
About 2 weeks.
2 weeks. I think he probably just needs a very short, sharp course of some antibiotics.
Okay.
Just to settle that down.
Yeah, no worries. That's what I thought. As soon as it started
Yeah.
going red, I was like,
Yes.
not
Yeah.
I know, sore toe, I know.
So I'm just going to give him the minimum he needs, which is going to be 2.5 mils 4 times a day. So it's a tiny-ish amount that he's going to need. Not stopping you walking.
That's the problem. Nothing really affects him. He just takes stuff in his stride.
Oh, not the bin, though.
No, can you knock the bin, please?
Not the bin.
See, now he's like, I definitely want to get in the bin.
Yeah.
Right.
OK.
Let's say bye, bye, bye.
Bye.
Thank you.
Off we go, then. OK. Thank you. Take care. Thank
Bye
you.
for now. There we go, folks.
Thank you.
All right, cheerio.
Bye.
Bye-bye.
Okay. Bye-bye.
Thank you very much.
Bye.
Health Centre, can I help you?
I know you worry about me, Julie.
I do worry, Michael.
There's not much I can do about it. I enjoy.
Yeah.
I woke up with what was a metaphorical axe between my eyes.
And then when the headache comes on...
It feels like there's a burning feeling trying to come out of my skull.
All right.
Might be a bit of alcohol in there at the moment.
Why is that?
I'd like a drink.
If this does not work, then we would be a little concerned and we would probably want you to have an endoscopy.
You've been fantastic looking after her. You've been soldiering on now for ages. It's really hard.
Don't give up. I
No.
never say die, it's attitude.
Yeah.
It's just soldier on.
Hello, Hobbit Health Centre, how can I help?
Hello, can I help? Thanks for waiting.
I've got an appointment at 10 to 12 for
Okay.
Minnie Edkins.
And who's the appointment with?
Oh, I'm not sure. It's only made this morning.
I didn't try Sky Wolf. I actually did try to go back on. I said, I'm fine, I'm ready to work in there. He said, no, go home, go to the doctors.
Jack Saunders, please.
I gotta go, Pat, anyway. My doctor's all right. I'll see you in a bit. Sound, bro. Blah, blah, blah. Hello, how are you?
Hello
all right?
there. Yes, come on through, not too bad.
I hope you can sort it out.
I hope so
I've got
too.
to work tomorrow.
Have you? All right, okay.
Well, I want to work tomorrow, unless
Okay.
you give me a note.
Okay, come on through, I'm Dr. Ahmed. What's troubling you?
My finger.
Okay.
It's just swelled up
Okay, and when did that happen?
this morning.
Okay, so it's
I'm
red
honest.
along here, obviously.
Yeah, but I've been working on a machine, like,
What
trigger.
work do you do?
Tree surgeon. So with chainsaws and all
okay.
that, so obviously it might have just rattled something. I
Yeah.
don't know, but it's loads of pus as well.
It might just ease itself, but we'll give you a course of antibiotics to sort that out.
This
seeing
chair
it.
is just from there upwards, just hurting.
Okay, so if despite the antibiotics that
Yeah.
gets worse,
Yeah.
then come in, because sometimes we need to, what we call, release the pus out,
Yeah.
okay? But it looks ready to go, so we'll give you a course of antibiotics.
Can't you just squeeze the pus out?
What's the matter today, then?
I've had a couple of, well, I had a lump down below.
Yes.
I thought it was nothing. It hasn't gone away, but there's another one that's appeared. I don't think it's anything sinister, but I just wanted to
Sure.
check it out.
So how long has it been going on for?
A couple of months.
Painful at all?
No, no pain.
Discharging,
No.
anything like
No,
that?
nothing.
Should we have a little look?
Yeah.
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 Do you want to come and
Yeah.
sit sort of down below in the vagina area?
Yes.
Or more in... So whereabouts?
So it's just sort of inside.
On the right side?
Yeah.
Or... Is it this bit? Oh, just here?
Yeah.
Okay, that's fine. Okay, hop off again then.
Okay.
Fine. So you're right, it isn't anything sinister. So you can breathe a sigh of relief. It's a cyst, and we have some glands down there that are called Bartholin's glands. We all have them, and sometimes we get cysts in them, and that's what it is.
Right.
Won't do you any harm at all. Sometimes they can get infected, but it doesn't look infected at the moment.
Brilliant.
So
okay.
nothing you need to do about it.
Yeah.
But if it did start getting much more swollen and painful, that might be a sign it was infected, and then we would need to see you.
Lovely. That's great. You put my mind at rest, yeah.
Yeah.
Lovely. Thank you very much.
That's all right.
Thank you.
Okay.
Bye.
Bye-bye then. Don't fiddle with it. Just leave it.
It's doing my head in now. It's like hard not to fiddle with. I
don't fiddle with
can't
it.
try fist either.
And let's just attack with some antibiotics.
They're bad
Sometimes,
for you, aren't they?
sometimes they can make, these ones can upset the stomach a bit.
Oh, I can.
So we'll see how you go, okay?
Look how big it is to everyone.
Do you smoke at all?
No. Why? Because does it affect them?
No, it's just that sometimes too much nicotine impairs healing. So,
Oh, yeah,
you know, but
alright.
if you're fit and well, all right?
So, do you reckon I should work tomorrow or not?
You can cover it up and see how you go at work. But you
Alright.
could give it a go and see.
Yeah, that's fine.
There you go. That's all of
So
that.
take all this and
Yeah.
this, yeah?
Yes.
Thank you.
Take care, Jack.
Cheers.
Bye-bye.
Bye-bye.
All right.
That way.
Michael Scudders.
Thank you, love. Oh.
So,
Yeah.
So how have you been over the weekend then?
Oh, well,
What's happened?
I got to go there Thursday.
You've got the letter and everything now. Excellent.
Yeah,
Okay, so
but I asked him, I said, have I got to stay in? He said, no.
no. Well, that's a bit surprising.
Well, I mean, I'm having toes off and then
Normally they keep you in, and you've been feeling all right over the weekend. You haven't had a temperature or anything.
I did, I was sort of sweating.
Well, you're on antibiotics. So.
Yeah, oh
Right
yeah.
then, let's take your temperature. 36.8. Have you taken any paracetamol or anything? Or briefing this morning?
This morning, yeah.
Right, let's have a look. What's going on? Move back.
I'm going up in the road.
Right then. Doesn't particularly smell, so that's good.
They don't what?
There's no, like, odour,
Oh,
strong
right.
odour.
What's that like now, Joe?
Not great, Mike.
Innit?
No, I don't like that. I'm going to have to get the juicy doctor to have a look at you.
When he speaks, it sounds like he's got a bit of a sore throat.
Should we have a little look in? This is just a torch, look.
Open your
It's
mouth.
open wide, it. Ah, tonsillitis.
Boy. Can I have a look in your throat and say, ah?
I've got like ulcers and blisters all underneath my tongue and then around my gums that going down my throat.
But it's like an itch in the back of my throat. It's not, I don't think
tickle.
it's... Yeah.
Deep breath in.
Done this before.
Yes, so many times.
Usually they are. I was told a couple of years ago they were so diseased that I'd stop getting tonsillitis, and I had them for years.
What, they'd just die off?
Yeah, genuinely.
Kale. Hello. Come on in. You have a seat here. You're the patient today. OK. Right. How can I help?
He's got sore throat, bad chest, to
Right.
the point where he's not eating. He's at ice cream and a bit of pasta in the last 2 days, which ain't like him.
Yeah.
He was up till 1, 2 o'clock this morning, sat on the sofa, shaking his legs, shivering, even
Right.
though he's not cold.
Yeah.
I checked his temperature was fine.
Yeah. Have you got a blocked nose as well? No. Earache? So it's the sore throat and the cough, mainly. Should we take your temperature?
I just wondering whether or not Eve had the same thing.
Yeah, it's possible,
So my
isn't it?
grandson's been ill as well with it, so...
So 37.5, so not really too dramatic. And let's just take your pulse next. That's normal. And let's have a look in your mouth. So if you open up really wide. You say oh? Oh. Yeah, they're huge, your tonsils, OK? And they are quite pussy. And I'm just going to have a feel under here, OK?
As I say, he's never ever ill, never.
So with a sore throat, you can have 2 different infections causing a sore throat, a viral infection or a bacterial infection. So the bacterial infections are the ones that get better quicker with antibiotics, and the viral ones are the ones that don't get better with antibiotics. There's some criteria that we've developed that help us work out if you will get better quicker with antibiotics or not. And it's a scoring system. So the first thing is that you need to have a temperature, and you've got a very slight temperature, but it's really not that high.
Yeah.
And you've said you've taken it, and it hasn't been very high. So I don't think you get a point for
I was
that.
going to say, no, it hasn't been anything over 37, so...
You get a point for having pus on your tonsils, and you do have some white bits on your tonsils, so you get 1 point for that, OK? You get a point for not having a cough, and you do have a cough, so you get no points for that, so you're still at 1, yep. And then you get a point for having really tender glands in your neck. And you don't really have very tender glands in your neck. So my feeling is that this is most likely to be viral, OK? So you'll get better on your own. And the important thing is to drink plenty, because if you don't drink enough, then you feel more unwell because you get dry. How does that sound? Is that all right? And I think we should see you again if you're more unwell, but I would hope that you've probably had the worst of it and that you'd start feeling better over the next few days. Good.
Right, there you go.
All right.
Come on then.
I know you worry about me, Julie.
I do worry, Michael.
There's not much I can do about it, Angel. So what are you going to do now with this?
Well, it all depends on what the doctor wants to do. Whether you know, your op's booked for Thursday. It's whether
Well,
we
they
just...
won't have me out there till Thursday now, love.
Yeah. Right, so we're just waiting on the doctor to come.
Okay. And who's I got to see? Doctor?
Your doctor,
Kenny.
Ahmed.
Oh,
yeah,
she's coming, is she?
She's on today, so and she saw it last week. Come in, please. Hi.
Hello.
Sorry.
Hello, Angel.
That's right. How are you, Michael?
Not well, not too bad, my love.
Haven't missed any tablets?
No, every day.
This Thursday, isn't it? The
Yeah.
procedure.
1 o'clock,
I think it
1
needs to be
o'clock.
seen in today, really, looking at it. It's got a lot worse.
Yeah.
All right, Michael, we'll sort you out, OK?
Well, we'll go stay here, have I?
Just for the time
We're
being.
just going to, like, our phone up vascular. And,
All right, that's cold.
Yes, I know. I've always got cold hands, warm heart.
Okay.
Let's give it a clean, get it dressed. Right, if you just bend up your knee, that's it, and just rest it there.
I've got hospital. I don't want to go to hospital.
Oh, my. It's for the best, get this foot sorted.
Great, you.
I'm doing it. I'm getting there.
Got there?
Yes. There we go.
Is that it?
That is it. You're done. Just going to get the shoe on.
Right.
Okay.
I better stay here and wait till you get that call then. Because he might want me to go straight out there.
Yeah. Right. Hi, yeah, I'm practice nurse at Hornford Health Centre. I've got a patient known to the vascular team with me. He's diabetic, and I feel that he's due an amputation on Thursday of this week, but his foot's significantly deteriorated, so I think he might need reviewing today.
How behind is the doctor I'm meant to see?
I think you're literally just about to be called.
Davy Mitchell. Hello, I'm so sorry to keep you waiting. Come on in.
Don't worry. I don't mean to look silly, but I'm going to put these back
Yes,
on.
do. I'm Dr. Lee. How do you do?
Not too bad, thank you.
Come in and have a seat.
Thank you.
Have a seat there, yeah.
I have a migraine.
Oh.
And I had it.
I'm so sorry to leave you in the waiting room.
That's all right. There were lots of children. They were very loud. It's okay. No, I have a migraine. I had one yesterday. They're rather new. I started having them about a month ago. And I think I've had 3 in 4 weeks now. And they're quite persistent. They seem to last the whole day and then some of the next day. But this one seems to have started in the middle of yesterday, and this morning I woke up with what was a metaphorical axe between my eyes.
And then when the headache comes on...
It's behind my eyes, and sometimes I get one back here and one back there as well, which feels like there's a burning feeling trying to come out of my skull, which is...
So awful, isn't it? They're awful things. Right, so what do you take for it?
Usually just paracetamol, but last night I took 2 cocodamol because I really needed to get some sleep and it hurt too much.
And did they help?
Well, they knocked me out like a light, so yeah, I think they helped.
Thank you ever so much. All right, cheers, bye.
Oh.
Well, he doesn't feel, because you don't sound septic.
No.
Which, to be fair,
Wait till
you're not.
Thursday.
Wait till Thursday, but to review it on a day-to-day basis,
Thing.
which we already are. But I just need to check, obviously, with Rita that she's happy with that.
Hello.
Hi, it's Julie about Michael. Hi, yeah.
So I've just spoken to the vascular on call, and he feels that he's not technically septic at the moment, but he said...
You know, obviously we're seeing him daily.
So if we safety net quite strongly with Michael, Michael mentioned that he hasn't got enough flucloxacillin, has he?
And that's fine, I'll bring the prescription round. I will probably do a letter at this point.
Like you say, it isn't hot, he's not got temperature, but we're very close to getting to that point.
Yeah, that's the worry, isn't it? But he seemed aware of that, and he was like, look, you know, you've seen him daily, get hold of us if you need us, you know, don't hesitate.
OK,
Well, thank you very much, Julie. I'll pop round with that. Thanks. Take care. Bye for now.
Frida's going to come round with your antibiotics in a minute. But the rest of your foot didn't feel off, if you know what I mean. The actual ulcer looked awful, but the rest of it...
I can't see the... I mean, you can. I can't.
But it is the worst,
Oh, I love darling.
Michael, if you don't feel well, we need to see you. If we're shut and there's a temperature, you go straight to casualty. But we'll be seeing you in the morning anyway.
Yes, you will.
And that's the prescription for the
I
antibiotics.
want that now, All right, my love, thank you very much.
If you take that next door, they'll give you the tablets.
Okay, my love, yeah.
All right,
Fine.
Michael. Take care.
Put my nose in and look at you tomorrow, all right? 10 to 9 is your appointment, yeah.
OK, then. Thank you.
All right. Take care, OK?
All right, love, yeah.
How are you?
I'm okay, how are you?
Yeah, not too bad.
I've got a birthday card for you and I never got a chance to give it to you.
That's kind, thank you.
Spider-Man one as well.
Do you remember when you made me that Spider-Man cake?
Yes.
Oh.
Did you have a good birthday then?
Yeah, it was really nice, thank you. I went to Devon
Oh, nice. Whereabouts?
with my mum, near Ilfracombe.
How is your mum? I haven't seen her for a
Yeah,
long
she's
time.
okay. She's not been very well, but she's okay now. She's okay.
Oh.
So it was nice to see her.
Actually, I have to stop you talking while I'm doing this. Sorry. Yeah, that's great. Have you got some more cocodamol at home? Or did you borrow someone else's?
I used all my girlfriend's because the ones I had are for my back, so they're far too strong.
So what I want to do is give you something slightly different that works in a different way.
Okay.
If you know one's coming on right at the beginning
Yeah.
of a migraine, if you take this tablet, with luck, it'll just stop the whole thing.
Oh, right, okay, cool.
It won't help with this one you've got on at the
No,
moment.
no, I just
But I
don't.
imagine that'll tail off in the next
Yeah.
few days. So, the important thing is to have these on you.
Yeah, yeah.
If this settles down, we don't need to see you. But if it keeps going, we need to get you back and start to talk more generally about long-term management.
Yeah, yeah,
of these.
absolutely.
Is that all right?
Yeah, that's
Right,
wonderful.
you can put those back on.
Yeah, oh, I think I'm going to. All right. Well, thank you very much.
Oh, well, you poor thing. It's a really rotten headache, that one. But
back home to bed for me.
Back home to bed, I hope within two... Well, then maybe you'll have tomorrow off.
Yeah.
All right. Is that all right?
Lovely. All right,
Great.
lovely. All right,
OK.
thank you.
Bye.
So we need to add your signature into there as well.
Okay.
So another signature.
Oh my gosh, how many times have you printed this?
Well, only once, I thought.
You are busy.
Well, it's the system that's not helping. It's really slowed down.
What we'd do without computers, we'd have to do it with pen and pencil and it would work every time then, wouldn't it? Anyway.
Don, what? Hello.
Hello there.
How are you?
Oh, not too bad.
Not too bad. Come on in, have a seat.
Thank you. Oh,
OK.
oh everything's been happening
Yeah.
for the last month. Angela's not been at their best
No.
with the chest infection and the water infection, which culminated in her having to go back to hospital because she had a fall.
Yes, I saw. Is she in hospital now?
She is,
She
yes.
is, right.
Dawn is the full-time carer for his partner, who sadly had a brain hemorrhage in 2010. Before that, she was perfectly well, and obviously this has been devastating for them both.
I mean, I would say come home straight away, but I wanted a social worker involved to help me because I'm tired.
Yes.
He has been looking after her 24/7 with the help of some paid carers. She is physically fairly well, but unfortunately has quite a lot of cognitive impairment.
I feel run down.
Yes.
I don't know if it's my tooth, I don't know if it's an infection I got.
Yeah.
Or...
If you open up wide, you've got quite a big swelling. I think you have got a dental infection in there, OK? So I think you need to go to the dentist. So do you know where you would find a dentist?
Yep.
Yeah? I'm just wondering whether we struggle to get you in to manage your health issues because of your responsibilities looking after your wife, OK? So I am a bit worried about you and your health.
And what's brought you here today?
Been about 6 weeks, I guess, and it's getting worse and worse. I keep getting more and more tired.
I feel absolutely exhausted. It feels like someone's drained me right out.
I mean, I'm sort of going to bed at 10 o'clock, waking up at 6 and still falling asleep again and then, you know, oversleeping and stuff.
I keep an eye on my diet because Slimming World and all that, and I've recently taken up swimming. I think I'm one of the oldest swimmers in Capricorn Country Club. I can barely get across the pool at the moment.
It's like going from here to there,
Yes.
but if I'm going any further than that,
Yeah.
it feels like I'm drunk.
Right.
When I know I'm not.
Yes. I think you're going to need a break, aren't you?
I need some help, just some help. Really.
Yeah.
Because I can't leave her for 1 minute.
No.
But I do need some help.
Yeah.
Specifically culminating in doing something with my bathroom because,
Yeah.
I mean, anything that would help us, like a wet room or something like that,
Yeah.
would help her greatly.
OK.
I'm hoping when I speak to the social worker that
Yeah.
they can at least push for a toilet downstairs because
Yeah.
most of the things that really goes wrong,
Yeah, it's all around toileting and washing.
yeah.
Yeah. OK, maybe I should do a referral too to occupational therapy, OK?
Yeah.
Getting a toilet that she likes is quite important, actually, isn't it? When she comes out,
Yes.
maybe we should arrange for her to have a community nurse come in and just do a bit of an assessment, maybe
Absolutely.
around the waterworks issue,
Yes.
particularly. You might want to think about
Yeah.
her having even more help, either at home or going into a home for a few days or a week
just every few months or so that you can have a break and you can look after yourself.
That sounds pretty... I know where you're coming from.
Don has very little time for his own health and has a number of health issues that we find it difficult to get him in to talk about. He has physical health problems, but he also is getting quite depressed and stressed now because the caring responsibilities are so huge. People who are full-time carers ideally need to make some time for their own health. This is very difficult, and we as a society struggle to support people who are carers.
You've been together nearly 30 years now.
I know. Well, you're very close and you've been fantastic looking after her. And really what I want is for that to be possible for many years to come. You've been soldiering on now for ages, and it's really hard, you know?
I just got to never... I just don't give up. I've got to never say die attitude.
Yeah.
It's just soldier on, you know?
Yes.
I make mistakes just like any other people do, but
yeah.
I try my best to learn from them.
Yeah.
It's not always down. I mean, we have some tremendous time.
Yes. OK, so you just let me know, all right? And you get your teeth sorted, yeah?
Okay, I'll try to
by
get
the
that straight away.
experts, OK?
OK,
all
thanks,
right.
Doc. I'm glad I had to speak with you anyway.
That's all right, yeah. I think it was
Necessary.
the right time for that, wasn't it?
Yeah,
all right.
absolutely.
OK, bye
Thank you,
now.
Doctor.
I am having an OCD moment. Okay. Of making sure all the envelopes are in their proper box.
Oh my God, you're worse than I am. It makes you happy, my love.
It does.
Actually, do you know what's really sad? It's the sort of thing that would make me happy too.
Richard Barnes, please. Morning. Come and have a seat.
OK. We haven't met.
No, hi, I'm Dr. Ramshaw. Right, what can I do for you?
I don't know.
Oh, right, OK.
I phoned up the treatment room.
Right.
And they just said, come down.
So I think it's booked down for a medication review. So, how are you doing?
My cholesterol usually used to be high.
Right.
When I used to come down.
Yeah.
Because it was more or less on my birthday.
Right.
Which is no good to me at all, is it?
It doesn't have to be on your birthday. It's around your birthday month.
Yeah.
So.
Well, I got to be within a good couple of weeks away from it, ready to be properly.
Yep, that's fine.
But it was always that little bit too high.
Yep. OK.
But that's
right.
Me.
OK.
I'm not going to go without everything. Not on my birthday.
No, no, no. You're on cholesterol tablets, blood pressure tablet, aspirin. OK. So what we need to do is just arrange for you to have a blood test done. OK.
Is that going to be now, or have I got to come
You've
back?
got to book an appointment, unfortunately.
This is what... Now, that's annoying to me,
Yeah,
see,
no,
because
I can
that's what I
understand
phoned
that.
up, and I said I always have blood tests and that.
Let me do it for you now, then.
Because I don't want to come back, because otherwise I've
I'm
got to
offering
try
to
and
do it
work
for
it. Yeah.
Yeah, OK.
Otherwise I've got to work it round...
Let me do it for you now. So what we'll do from now on, after today, it should be one trip. I totally agree.
No.
All right.
Might be a bit of alcohol in there at the moment.
Why is that?
I'd like a drink.
How much are you drinking?
Oh, Skittles. That's got to be 4 pints.
And how many times a week do you do Skittles?
I only do that once.
OK, so what
But
about the
then
rest of the week?
Well, I do like to have a drink. I know when to stop, see, because it tells me
What tells you?
to drink.
Right, OK.
Go over the top, you suffer.
Yep, that's very true. Do you need a plaster? There we go.
Right.
Have you got all your medication?
Yeah, not
Yeah.
long ago.
Fine. OK?
OK,
All
no
done?
problem. Look it out.
OK.
There's nothing else.
That's it.
You didn't want me weight or anything?
No.
I'll tell you, it's 11 and a half, and I'm that high.
You're not overweight.
I know I'm not that
Yeah.
high. All
OK,
right,
bye-bye.
Thanks a lot. Cheers. Where am I going? Over there.
What time's your appointment?
11:30.
And what's your name?
Maureen Whitehead.
Maureen. So it's not until the 9th. Next week. I think it's a week today, yeah. Yeah, a week. I'll print it off for you. Don't worry, my love. There you go, Maureen. See you next week, my lovely. Can I help?
I'm Dr. Cordell. Let me get their names straight first of all, actually, because I'm not sure. Cherry, yep. Cherry and James. And you're both applying for medicine. So have you put in your forms or?
Not yet.
Okay. So this is your first time in general practice then, presumably, except for maybe you've been as patients at some stage. I've seen 3 people already today, just to tell you the sort of things that we see in general practice. The first one was a lady who has been under treatment for depression. Second patient was an elderly lady with several medical problems. She had a skin condition, which we looked at. OK, so if you're ready to watch, we need to put one other chair over here. So if you guys can sit here, obviously try and watch and not take part unless the patient involves you, because they sort of come to see me, really.
Peter Ryland. Hello.
Hello, Dr. Lee.
Right, so come in. Now, this is Leslie Black, who's our new doc.
Hello.
Come and have a seat here. Well, I'll sit here.
Right, then we know where we are.
So that's where we are. So...
I had a thrombosis in this leg. Well, the same pain has come back. I thought I'd better get it checked out, simple as that, because they're nasty.
How long ago did you have the one before?
1 year, 1.5, something like that.
OK. And you took some blood clotting warfarin, probably, or something for 3 months, did you?
Injections every day. Sorry, 6 months. But it's not in one place. It's all up my leg just feels aching.
When did it start?
2 weeks ago.
Anything make it worse?
Long walks.
OK.
Don't do long walks, I know.
And when you do a long walk, what do you get?
Aching. It's aching now.
So the other question I would have would really be about your circulation.
You know, I'm a diabetic.
Yes.
And my feet are numb quite a bit.
OK. OK, let's have a look over here, if that's all right.
Do you want my...
Can you pull it up? Pull the trousers up. So this is a good start. I'm just going to my room to get the tape measure.
That's no problem. Learning, are we?
Yes, yeah, I just started yesterday.
Hey.
So I'm not very good with the computer.
Neither am I. I'm computer illiterate, actually. I can crush a computer by switching it on.
You're their very first patient, so that's terribly exciting, isn't it?
Oh, for whom? For me or for them?
I don't know. OK, so this is Cherry and James. Mr Jennings, come and grab your normal seat. So Cherry and James are both doing their A-levels and they both wanted to become doctors for some extraordinary reason.
Dear.
What do we need to talk about today?
I think I read somewhere that you do test for... what was it? The thing down here.
Prostate?
Prostate.
Talk about prostate cancer blood tests, is that what you're
Yeah. You know, so over a certain age, they...
You've had this done before, actually, haven't you?
Many moons ago.
Let's just have a look. You've actually had this checked 3 times before.
Have I?
Yeah, in 2005, 2011 and 2015. And on each occasion, the blood test was fine. OK, so it is only 2 years since you've had it checked.
Well, I didn't realise it had been done this recently.
I've no objection to you having another one, OK, but before we do that, let me just talk about the limitations of the test, OK? Because it is very heavily plugged in the media.
Yeah.
So what it's measuring is a chemical that's produced by the prostate gland, OK? And everybody has that chemical produced. It's just a question of the amount that's produced. So, you know, I'm producing it, you're producing it, James is producing it. Generally, young men don't produce very much of it. As we get older, we all tend to produce more and more of it.
Yeah.
And it will also go up if you develop prostate cancer. But so if you see someone who's got a slightly raised PSA level, you know, it's not immediately clear whether that's because they're developing prostate cancer or because it's just a naturally large prostate. OK. So in that situation, we need to do further investigations. I mean, we would need to examine the prostate through the back passage.
No, I've had that done.
You've had it done before.
OK, well, I think you've set my mind at rest.
OK.
Do you want me to...
So is that a yes or no? Do you want to have it done or not?
That's a no.
That's a no. OK. There is no right and wrong answer here, but I think having seen your previous results, I mean, it would be reasonable to check it again in 5 years' time, or if you develop any symptoms of concern, which is quite a hard thing to evaluate, but something like passing blood in your urine, passing blood when you ejaculate. Those things we should check it.
Okay.
Okay.
Yeah.
There we go.
That wasn't painful, was it?
It wasn't too painful. No one got an examination. Good. Okay. See you again.
Yeah. Bye-bye.
Cheers then.
All the best. Cheers.
Just write me notes up.
So when you had a thrombosis before,
Yeah.
I expect you had a swollen calf.
The doctor spotted it straight away. There was no bumps or lumps or whatever.
Yes, so that's 237. I'm just measuring the size of your calf to see if it's much different. And it's about the same, in fact. This one's a little bit smaller. I'm just going to feel the pulses in your feet to make sure your circulation's all right, though because of your diabetes, this may have gone a long time ago.
No, they said you've got quite good feet for your age. I thought, thank you.
What is your age?
71.
OK, well, that looks fine. And the good news is I don't think it's anything worrying, but the bad news is I can't tell you exactly what it is.
Thank you.
I think if this grumbles on and on, we can see it again. But at the moment, it's a bit of an ache there. Nothing there to find, so wait and see what happens. Almost certainly, you know how aches come and they go. Is that all right?
Yeah, that's
But
fine.
you don't need to worry. We don't need to whiz you up to Southmead for the DVT thing.
I'm glad about that. Thank you very much.
That's a pleasure. Nice to see you.
Have a nice day.
Hello.
Hello, have a seat.
Thank you.
I'm Dr. Jewell.
I know.
Do you?
Yes,
oh,
I do.
dear. Have I seen you before?
Oh, a long, long time ago.
Was I any good?
Maybe.
You've forgotten. It's great. That's really... No, it's great. If you... Oh, look, there we are. Not that long ago. April 2015.
Well, that's still a while ago. We're in 17 now.
You were feeling tired?
Oh, my goodness, yeah.
You still tired?
At the moment, I'm just...
Why is that? Is that why you've come today?
Yeah, I'm totally exhausted. I've been exhausted, proper exhausted, about 3 weeks, but that is going along with being sick and feeling sick all the time, constantly.
Now, you eat and you feel sick straight away?
Yeah.
OK.
I feel sick even before I eat, but I know I have to eat, so I do try.
And do you get any pain?
Not pain, it's just this awful feeling of just wanting to vomit straight away. And I have vomited.
Asthma.
Do you want me to carry the baby and you can carry the baby? You're very sweet, aren't you? Don't be sick on me, though. Hello, are you coming?
Sorry, thanks.
That's all right. Hey, what's wrong with you, Bobbin?
Oh, darling. I know you're having fun running about.
You were running around all over the place, weren't you? Hey.
Right, there we go. You can run around
Right.
there. Thanks.
All right, good. What can I do for you?
This little lady
Yes.
has got reflux.
OK.
And I'm hoping not, but I think she potentially might be allergic to dairy as well.
OK.
She's not lost weight, but she's dropped percentiles as well.
Have you got the red book
I've
with you?
forgotten. But I can bring it later.
OK, all
If that
right.
helps.
So, well, tell me about the centaurs first of all. Then, what
So
have
she
you
was
noticed?
on the 25th for weight, and then she dropped to the 9th.
That seems quite a drop, actually, doesn't it? Yeah.
But then when I went home, I thought about it, and I thought she's actually been sick quite a lot.
Tell me about the sickness.
Probably once or twice a day. She doesn't
Okay.
seem very well in herself.
How much is she vomiting?
It was quite a lot this morning.
Is it vomit that dribbles out, or is it vomit that
It's
that
projectile,
shoots out?
yeah.
Yeah, can I just check her temperature
Yeah,
while
of
she's...
course. Well, you probably won't
Sweetheart.
notice,
Hello,
darling.
gorgeous. You're so good, aren't you? You've been so
Cheers,
good.
Cookie.
Lovely, OK. I'd like to have a little feel of her tummy, actually.
What are you doing, Change your nappy. We're changing your sister's nappy, aren't we?
Hello. She's peeing all right?
Yeah.
Yeah.
Yeah, quite a lot. Oh,
It
it's your baby sister.
doesn't strike me that she's particularly unwell with it. I mean, she's nice and alert, looking around. She's not got a temperature. I'll look all over for rashes in a minute. Haven't seen anything yet. She's not dehydrated.
No,
Skin tone
no,
is
she's
good.
having plenty of wet nappies.
Yeah. It would be reasonable to try something like Gaviscon and see if she's less sicky with that.
Okay.
But actually, the thing I'm most concerned to do is to have a look at this weight chart and get it validated, really.
Okay.
You could pop her back with the chart tomorrow.
Yeah, that would be fine.
Is that all right?
Yeah. That's what I'm saying. You're causing real chaos.
I want to feel your belly. Just pop yourself on the bed if you don't mind. I'm just feeling around to see if I can feel any lumps or if I
That's
feel
uncomfortable, that side.
Okay.
But not painful.
Big breath in. And out.
That makes me feel sick.
And again. And out. That's fine. OK, that's fine. I'm not going to do anything else. Come sit down.
No, I feel sick. Ugh.
I'm going to label this as being dyspepsia, meaning indigestion, all right?
OK.
And the reason I'm going to label it like that
Sorry.
is the way you describe the timing of it, that it happens instantly, OK, after you've eaten. So that's why I think the absence of pain is a little unusual, but it doesn't bother me enormously. All right?
OK.
Does it ever wake you up?
The sickness feeling does,
Yes.
yeah.
OK.
I thought you retired anyway. Did you not retire?
Yes.
OK. You love it that much, you've come back.
I decided retirement's a very bad idea.
It keeps you going, doesn't it?
Yes, I think the problem about this is I keep thinking I'm enjoying this too much. This is becoming rather self-indulgent. And actually, if you're not careful, you just go on and on and on. There was a famous chap that we knew who had grown up, I think, in Czechoslovakia and was Jewish and had to come here and came here before the war as a refugee.
Okay.
As a doctor. He went on working until his 80s or 90s or something. You think, what move? You know? So I'm not going to do that.
We'll see.
I'm now going to give you anti-sickness thing, and you take that 3 times a day.
OK.
Now, you go on taking the metoclopramide until the vomiting stops.
OK.
And then you stop them.
it. OK.
The omeprazole, I've given you for a month, and you should certainly, and if it's working, you should certainly take it for a month. Now, if this does not work, then we would be a little concerned, and we would probably want you to have an endoscopy.
OK. Lovely. Thank you very much, and I will see you when you're 85.
What a thought. Ghastly thought.
Thank you, Dr. Jewell.
Bye-bye.
Thank you very much.
Janet Arcourt Barker. Hi, I'm Dr. Lee.
Janet.
Yeah,
Thank
come
you.
have a seat.
Oh, thank you very much. I fell down 3 weeks ago in the office. I tripped and I fell. So, yeah, I find it difficult walking. I limp a little bit. And I think it's a bit swollen.
This is yours. You
This is mine,
treated
yeah.
yourself,
Yes.
have you? Let's get your foot up on here so I can
Yeah.
have a good look. Did you fall off shoes or were you?
Yeah, I was in heels as
Yeah.
usual at work, and I tripped, and then I just fell flat. So this side here, this hurts. I touch it, and it's painful.
Okay, so if I just run my finger
Yeah.
down there.
Yeah.
It's there.
Yeah.
Quite sore, isn't it?
Yeah.
So, can you put your toe up?
I can, but it's...
Yeah. Right. So the next thing, cruelly, I'm going to get you to stand up. See what you can do with that foot.
Okay.
But specifically, can you go up?
Ouch!
So that's really sore there.
Yeah.
Were you able to walk on it straight away once you'd done it?
Yes.
So it started to get better and then it started... I'll just wash my hands. So I think it must be a bruised bone, really.
Okay.
I think
Yeah.
it's obviously not broken.
Yeah.
Because you've got a lovely arch and you're moving your foot around and you're not jumping off the chair when I feel it.
No.
Almost certainly it's going to get better. And I say with these things 6 weeks, but I'd be pretty confident that that's nothing serious. Okay.
Thank you,
well,
Elizabeth Lee.
It's a pleasure. Pleasure. I hope that settles because I think it will.
Thank you very much. I want to wear my heels.
Yeah, you want to get
so I miss them. Thank you.
Soon.
All right, thank you. All right, well, I hope it all goes well today.
hopefully. Thank you.
Take care, bye now.
Bye-bye.
Nice to see you. Take care.
Thank you very much. Say thank you. Say ta-ta.
Bye-bye.
Ta-ta. Thank you.